Good morning, good afternoon, good evening. I want to thank UNICEF for bringing together donors, researchers, heads of agencies, and others who are working together to fight COVID and increase vaccine uptake. As we all know, the global supply of COVID-19 vaccine is no longer our biggest problem. Rather, it is vaccine distribution and low rates of vaccination in low-income countries. The reasons for this are many. They are varied, and they can be very localized to communities. From fears due to misinformation and concerns about side effects, to the drop in the perceived risk of the threat of COVID-19. All of these are preventing people from getting this needed vaccine. We hear stories of Venezuelan migrants and Syrian refugees unsure of whether they are eligible for vaccines, and of women in parts of Eastern Africa with less access to health information and unsure of the impact on their pregnancies or future fertility. But we also know that there are very good reasons to prioritize vaccination. Vaccines are safe. Vaccines protect against hospitalization, severe disease, and death. Vaccines decrease long COVID conditions. Vaccines reduce the risk of new variants. And vaccines reduce future social and economic impacts of lockdowns or closures. Clearly, vaccination is needed. The job ahead of us is to communicate in ways that connect with community concerns through trusted sources. Many colleagues here are already doing amazing work to make this happen, taking tailored approaches, working with trusted community leaders, spreading accurate and evidence-driven information, and targeting vulnerable and remote communities. But there are a few areas that need our concerted effort moving forward. First, we must counter rumors and misinformation through channels like social media. Second, we must engage healthcare workers as critical communicators to build vaccine confidence. For example, in Nigeria, polio vaccinators are leveraging their community relationships to advance COVID-19 vaccination. Third, we must address the thinking that COVID-19 is not a big threat anymore. Finally, we need to continue to build the evidence base while maintaining political commitment and momentum at the highest levels. That is why I'm announcing CanGive, Canada's global initiative for vaccine equity. Through this new initiative, Canada is providing $200 million in funding for a new initiative aimed at supporting vaccine rollout in 13 countries. This funding will provide $100 million for UNICEF to build up vaccine logistics, supply chains, and the health workforce, while also undertaking surge vaccination campaigns. Together, we can find the best path forward to find solutions tailored to each community, country, and region. Together, we can champion approaches to support countries in reaching the goals they set for themselves. And together, we can dismantle the barriers that are holding back people in vulnerable situations. So I'm looking forward to hearing more from this event and keeping the conversation going about increasing vaccine uptake and confidence. Thank you. Merci beaucoup.